Hello, and thanks for stopping by for this year 2021 Medicare Advantage Clarity presentation. This is me. My name is Tom Basie. I provided both my phone number and my email address. I'm licensed and local, that is within the state of Texas, also Oklahoma, Florida, and California. But really, please feel free to reach out to me about questions and generically about Medicare, for example, and supplements and advantage plans. My email address, tom.basie@gmail.com. I also speak Spanish, si quieren hablar en español. So this is what I'm going to talk about today: understanding your Medicare choices, eligibility and enrollment, the advantages of Medicare Advantage plans. I want to talk specifically about prescription drug coverage, and that covers both Advantage plans and med substance. They don't have drug coverage included. I recommend a drug plan. And I'll talk some specific 2021 Medicare Advantage plan information. I'm going to present 4 plans, nice side-by-side comparison to look through the features of those. I want to talk about how agents like myself can be of assistance, remark briefly about some additional resources that are available to you, and I do want to talk briefly about United Healthcare as someone you should consider it for your carrier as a source for Medicare Advantage plans or med subs and prescription drug plans. Understanding your Medicare choices. Step 1, you've got to enroll in original Medicare, Part A and Part B. Well, Part A is typically already paid for by somebody who's been working here in the U.S., taken out of your paycheck and the FICA tax, and it covers hospitalization. Part B typically has not yet been paid for, and that's for doctor's visits, outpatient testing, imaging, things that don't occur in the hospital setting. And typically you're going to have to pay for that. In 2020, there was a deductible for Part A of $1,408, and there was a deductible for Part B of $198. And the monthly premium for most Medicare beneficiaries in Part B is $144. That can be withdrawn directly from your Social Security benefits if you're taking Social Security. So at a high level, Medicare is Part A for hospitalization, Part B for outpatient. Probably already paid for Part B, and you probably have to pay, for Part A, and you probably have to pay for Part B as you enroll. Now, once you've enrolled in Medicare, there are 2 options you can consider. Option 1 used to be the only option until, say, the early aughts, and then option 2 came on, which is an Advantage plan in 2003, 2004, thereabout. Option 1 is called Medicare Supplemental Insurance. When you get one of those, and they're very thorough coverage, they don't cover drugs though, so I recommend you get both a Medicare supplement and a Part D plan, Medicare plan. Those are 2 standalone plans that can be secured from 2 different carriers as need be, but you need both of those to supplement Medicare. Or alternatively, you can do option 2 that kind of has both of them combined. But it has Part C, which has Part A and B in it, and it covers Part D as well. So if you go to option 2, you can get a single plan that has all that stuff included in it. That is some supplemental coverage to Part A and Part B, drug plan, and there's even some additional things that we'll talk a little bit more about. So med sup versus an Advantage plan. To be eligible, typically it's for 65-year-olds. Now, having said that, you can get into Medicare if you're under 65 on the basis of a disability or some other special situation, perhaps like a chronic illness. Also, you need to be a U.S. citizen or a legal resident who's lived in the U.S. for at least 5 consecutive years. Those are the main characteristics of Medicare beneficiaries. When can you enroll in that? Well, not only can you enroll in the month of your birthday for your 65th year, you can do it 3 months afterwards and 3 months before that, and that's your initial enrollment period. So during that window of time, you can enroll in an Advantage plan right around there, contingent upon being involved in Medicare as well. I do want to remark that there is a penalty if you don't get drug plan coverage. So I recommend, even if you're not taking a single medication, I would encourage you to consider, can you find a low-cost solution, a drug plan or an Advantage plan, even if you don't have medication, so that you can avoid the penalty that does occur if you wait and then later, a year later decide, oh, I need a drug plan coverage. Well, there'll be a penalty for that. That penalty will be 1% of the average monthly premium for each month that you delay enrollment. There's a couple other times enrollment period someone should be aware of. There's the annual enrollment period, which is October 15th through the December 7th. And then there's the Medicare Advantage open enrollment period, which is basically Q1 of the January 1 to March 31. Now, during the annual open enrollment, you can add or drop or switch Medicare coverage in that time, where conversely, the first quarter immediately after that, you can make a one-time change. You can either switch to a different plan or go back to original Medicare. So it's more limited. But those are two windows of time, in addition to the initial enrollment period we talk about, where someone can add, for example, a Medicare Advantage plan. Now, there's something else, special enrollments. Special enrollments despite, even if it's not initial for you, even if you're not in either of those two enrollment windows, there's a potential scenario where you can get involved, select an advantage plan, for example. If you retire and you lose coverage from the employer, that's a special enrollment period around that time. If you move out of a plan service area, if you're in an advantage plan, they're typically network-based, zip code and/or area-based. And so if you move, then you get a special enrollment period in SEP when you can make a change again. If you have financial hardships and you qualify for extra help, which is a federal program, for example, you can get, there's also some state things. If you qualify for those, then you can get a special enrollment period that, independent of the calendar, then you can enroll in a Medicare Advantage plan. Or if you get diagnosed with certain qualified chronic health conditions. So those are 4 instances above and beyond all the other time slots that you can enroll in the year, where if that happens, then you've got a special enrollment period. Now, some of the advantages of a Medicare Advantage plan. There's over 24 million people in the U.S. as of February of 2020 that have those. Must be something good going on there. Of those, 93% of them report satisfaction with their Medicare Advantage plans. So not only do many people have them, many people are quite satisfied with them. And the reason is likely because of this third number, 25% less spent on health care compared to original Medicare. So it's a way to save above and beyond just original Medicare. I'll tell you a couple more things about that. So if you compare original Medicare and a Medicare Advantage plan, both of these have hospital stays. If you recall, that's kind of Part A. Both will cover some medical care like doctor's visits. That's Part B, and preventive services like flu shots. So in original Medicare, those are covered in an Advantage plan as well. What is not in an original Medicare is prescription drugs. I've remarked that previously. There's actually some routine vision coverage, perhaps an annual exam, often with a $0 copay. There's some potentially routine hearing exam and potentially some hearing aid benefits. Similarly, I neglected to mention the vision coverage, and maybe some monies or benefits associated with eyewear. And then this is a very important one, limit your out-of-pocket cost. I haven't mentioned this previously, but there's no out-of-pocket maximum on original Medicare Part A and Part B. So I'm going to estimate it's typically an 80-20 split. So if you have a big medical bill, for ease of discussion, I'll make it $100,000. I estimate you will pay 20% of that out of pocket, or $20,000. And there's no out of limit. Where conversely, if you enroll in an Advantage plan, there's an out-of-pocket limit. It's set $4,000, $5,000, whatever the number is. It varies plan to plan, if you'll notice here. So that's a very compelling financial reason to get an Advantage plan. I'm going to run through a top 10, not necessarily in order, but these are just important things to mention. I've remarked about some of them, but I want to reemphasize them because they are that important. So the advantages of Medicare Advantage. Number one, I don't know if it's an advantage or not, but you must continue to pay your Part B premium. So it's good to know that, because sometimes you'll hear about low cost, sometimes even a $0 premium Advantage plan, and that's great, but you have to be in Part B and be paying that premium to get the Advantage plan. So you do have to take care of that, to keep paying Part B. Medicare Advantage has you covered. So like that previous graphic, it has everything Medicare has and then some. Number three, joining a Medicare plan may affect your current coverage. I remarked once about leaving a job and losing coverage. Another scenario is veterans. Sometimes they've already got coverage, so it's just important to consider which plan you get, and because there may be some necessarily coordination of benefits you might want to get. For example, an Advantage plan is available without drug coverage if you want to continue to get drug coverage, say from the VA. It says, number four, that it's best to use network providers. I mentioned about networks. Not every provider is in a network for an Advantage plan, but what will happen is it'll simply cost less if you use the services, be it a pharmacy or a care provider that's in network. It costs less. So it's best to use network providers. The reason, that's the rationale for that. You may qualify for financial assistance. I already mentioned extra help, and then Medicaid from the state. If you qualify for some extra help, there's some special Advantage plans associated with, for example, dual. If you're on both Medicaid and Medicare, that have even more richer benefits, if you will, more thorough coverage, lower copays, that kind of thing, less out of pockets. 5 more things I want to talk about here. I said it once, but I'll say it again. If you enroll in Part D, which is prescription drug coverage, you may pay a penalty. So it's important to consider, even if you don't have any current medications prescribed when you join. If you don't get a drug plan, you'll be penalized when you do eventually. A Medicare supplement plan is not a Medicare Advantage plan. That's the option 1, option 2 that I showed earlier in the presentation. A Medicare supplement plan actually has very thorough coverage. You can get some that are available to have almost no out-of-pocket costs, but they are kind of pricey. In addition to continuing to pay the Part B premium, you do have to pay the MedSup coverage, and then it doesn't have drug coverage actually. So you have to get yet another plan, a drug plan, or I strongly recommend that you do. So that's a distinction. An Advantage plan, you enroll for that. It has some copays and out-of-pockets, but it's typically quite cost effective per month, and it does have drug plan coverage included. Keep your member card handy. That is, you no longer have to carry around your Medicare card. You can keep it safely at home, and if you go to the hospital or the doctor or the dentist or the vision carrier, if they all accept these Advantage plans or the Advantage have the coverage, I rather you just show that same card everywhere you go. A Medicare Advantage plan offers the same protections as Medicare. There's nothing lacking from Medicare. In fact, there's more. And then the last one, it says you have a built-in financial safety net. I'll reiterate that about the out-of-pocket maximum. There is no out-of-pocket maximum on traditional Medicare by itself, but if you get an Advantage plan, there will be some established out-of-pocket maximum. So you know you'll never spend more than that on your health care that year. Okay, this merits some discussion. This can be a point of confusion, people, and this is dictated by the federal government. That is initial coverage, coverage gap, and catastrophic coverage. Why is it that a single medication for a single patient at a single pharmacy costs different things at different times of the year? Well, this is the reason why. Number one, there is potentially an annual deductible. Maybe there's a $0 deductible, but if there's a deductible on the Advantage plan or a drug plan that you sign up for, the insured has to pay that amount before the coverage takes place or the plan starts having effect or assisting. So if you have a $100 deductible on a plan and your medication costs $50 a month, well, then the first 2 months, you're going to pay that out of pocket because the coverage doesn't kick in until the deductible's met. Once you do that, there's the initial coverage, the coverage gap, and the catastrophic phase. What happens is there's limits on how much the total cost of medication have been to determine what phase you're in. I'm going to use an expensive example to make the math easy. I'm going to say if your bill is $1,000 a month worth of medication. So if you are initial coverage, if you notice it says total drug costs reach $41.30. So if your bill is $1,000 a month in the initial coverage phase, well, the first 4 months you haven't met that yet, and so you're going to stay in this initial coverage, and there's going to be a copay. And I'm going to make up an example. I'm going to say the copay turns out to be only $100 on the set of medication that costs $1,000. So the total cost $1,000, and the copay in that instance for my made-up plan is $100. So those first 4 months, you pay $100 on that. Then once you've exceeded that month 5, you have to pay 25% of it. So where you were only paying $100 in copay, once the total cost of your drug have exceeded $41.30, you go into the coverage gap, also known as a donut hole. It's not a popular place to be, but it's what happens. The good news is you get out once you exceed this number here, $65.50, but you're going to have to pay 25%. So the next 2 or 3 months, then 25% of that $1,000 is $250. So you were paying $100, then you were paying $250. Once your budget in month 7, once you've exceeded that, once the cost, maybe you have to go to 8 to get there, but if you go to, once you've exceeded that $65.50, then you drop back out and you're in the catastrophic phase. And at that point, you're only going to pay $9 for most drugs or 5%, whichever is greater. But so you've gone down to 5%. So potentially in my hypothetical example, you were paying $100 in initial coverage. It went up to $250 in the coverage gap, and then it dropped down to $50, 5% at once your total cost of drugs exceeded $65.50. So that's why a single medication will cost different things during the year. It's defined by the federal government, and all drug plans and Advantage plans adhere to this. A little bit more on drug coverage. I'll reiterate total drug costs. Not talking about what you as the insured would pay, but it's what the thing costs. So I mentioned a $1,000 drug bill and you were only paying $100 of the copay. The $1,000, what it costs, that is what you and the plan are paying each month for, that is the total drug cost, and that's what was used to determine whether you were in or out of the donut hole. Out-of-pocket cost is what you pay, the copays, and it doesn't include the premium though, however. So that there's what the insured paid, and then what the insured plus what the company and carrier pays is what the total drug cost. Drug coverage a little bit further here. Pharmacy network. In the United Healthcare instance, there's over 65,000 pharmacies in network. There's likely one near you, but not every single pharmacy is in network. And as you'll recall from previous remarks, it's typically more cost effective to go in network. And then finally, so that's one form of savings, is go to the in-network retailers. You can also save by going to mail order. So 2 options to save. Number 1, it's always going to be more cost effective to go to in-network. And then number 2, you can potentially save by getting mail order. And there's some time savings and safety savings maybe to do that. do want to talk about the drug formulary. That's basically the list of the drugs. It is not all inclusive. Not every single drug in the world is on there, but each plan has a drug formulary. And within that, they're defined into tiers 1 through 5. As you might imagine, there's a cost difference between them. Tier 1 is the most cost-effective medications. That's preferred generics. And then tier 2 is generics, just not preferred. Tier 3 is preferred name brand drugs. Tier 4 is non-preferred drugs. And tier 5 is specialty drugs. You might imagine those are ones that are expensive, maybe some cancer treatment or something like that. So tier 1 through tier 5 is just how the formulary is divided up. And that's how they determine the cost of each medication. A couple other remarks. Step therapy is when you try to use a lower cost medication to treat something before you go to the high cost version, which is an economic way or financially beneficial way to try to treat a condition. Quantity limits, sometimes simply there's only so much you can get in a number of pills or quantity or something in a given time frame, for example, in a month. And then prior authorization is another thing. Sometimes medications are simply not going to be made available. Prescription can't be refilled without physician approval. Having said that, you can get exceptions to both the formulary. Remember, not every single drug is on there. So if you need a drug and it's not on the formulary, or if you need to overcome one or more of those prescriptions, you can request an exception. So an exception is either get the drug on the list or some of those limits, like the quantity limits or prioritization. Notice if you do that, you can get an exception request submitted by the physician, and it can be expedited if the physician deems it necessary for your health. Typically, it turns around in 72 hours. Okay, so having gone through all that, now I'd like to show you 4 examples, and they're laid out side by side nicely of 4 plans that are available. These happen to be available in the North Texas, kind of Dallas area or the northern part of the state, but similar plans, perhaps with different numbers, but similar plans are likely available where you live somewhere in the U.S. So let me show those plans to you. 4 plans. These first 2 are called Plan 1 and Plan 2. They've been around for a few years. This one just called Advantage Plan, and this one called Choice. These are relatively new in the Dallas-Fort Worth area. This has been around a year or so, and this is the first year. This one's available in 2021. These 3 are HMOs. That is, you have to go to carriers in the network to receive care and to receive the benefits. If you go out of care, you're going to have to pay for all that out of pocket. Or conversely, this one does have choice. It's PPO. There are some out of network options. For this out-of-network options, typically it's going to cost you a little bit more, and/or so there's a little bit lower benefit, perhaps, and/or a higher copay is typically what happens. Plan 2 is actually one of all 4 of these. It's the only one where there's actually a premium per month. The other 3 are actually $0 premium. This one, you're paying the premium on Plan 2. Typically, what happens is you drive down the copays. Copays cost less, and/or benefits are higher. So those are kind of 4 nice plans to consider and look at the differences and how the plans work. I've already remarked about the premium. 3 of them cost $0 per month. 1 of them costs $73 a month. There's no deductible medically for any of these 4 plans. It's $0. For all 4 of these plans, a primary care visit costs $0. There's a slight difference in price for a specialist, however. Plan 1 has $35. Plan 2, where you're paying monthly, it has the lowest copay of $20 for a specialist. The Advantage plan has a $25, and then the Choice plan, which is the PPO, has $35. So that's kind of the example of where this is the lowest one. It's because you're paying a premium monthly, and this has the highest copay. It's because that flexibility is going to cost you a little bit. Specialist referral required. If you're going to a specialist on an HMO plan, you got to get referral from the primary care. That's not the case on the PPO. So that's that flexibility. There's both the flexibility in being able to go out of care, and there's flexibility in not having to get referral for a specialist. That's why that appeals to some people. Inpatient hospital care. This is another nice example of how the pricing can vary. Now, actually, Plan 1 and the Advantage Plan are quite similar in certain ways, but the differences between them will become evident as you look at some of these. And this is example 1. For days 1 through 5, Plan 1 costs $275 a day for days 1 through 5. For the plan where you're paying the premium, it's actually only $150 copay per admit. So it costs less to go to the hospital on Plan 2 than on Plan 1. On these next 2, on both the Advantage Plan and on the Choice Plan, it actually costs more, and it's 1 more day. So instead of $275 on Plan 1, it's actually $325 per day, and it's days 1 through 6 on both the Advantage Plan and the PPO. And then the skilled nursing facility stays. This is interesting. The pricing, it's $0 for days 1 through 20 on all 4 of these plans. And then actually for days after that, for a while, it's actually the same price, just the number of days one has to pay varies. It's $184 for days 21 through 42 on Plan 1. On the plan 2, if you recall, where you're paying a premium, it actually only goes down to $38. After that, it drops to $0. So all these plans drop to $0 after something. So this one has the shortest number of days you're paying that $184. The Advantage plan, you go to day 42, which is the same as plan 1. I was kind of remarking they're similar, right? We've only seen one major difference so far between the two. And then on the PPO, actually, you have to go all the way to day 57 before you drop to $0 copay. The outpatient surgery, the number is the same kind of as the per day on the hospitalization. So it's $275 for outpatient surgery on plan 1 max, and then it's only $150 is the max for the plan 2 where you're paying, and then it's $325 for these other 2 plans. There's diabetes monitoring supplies at $0 copay for all 4 of these plans, and there's home health care is also, there's a $0 copay. I've got 2 more pages like this, but already I hope you're getting a feel for how these plans are similar and yet different. Here's some more benefits on this. Radiology services. So if you're getting some x-rays, the first 2 plans are $125, and then the next 2 plans are actually $150. For diagnostic tests and procedures, these first 2 plans cost $20 copay. It costs $25 for these newer plans. Lab services are actually $0 for all 4 of the plan. And then outpatient x-rays. On the HMOs, there's no copay on there, $0 copay. It's a $50 copay for the flexible PPO. Ambulance is the same for all 4 of these, $250 for air or ground is the copay. Emergency care is the same for all of these. Urgent care, if you go to kind of an urgent care facility, not a necessarily emergency room though, it's a $40 copay for these 3 HMOs. It's actually down to $30 for the PPO. Okay, I've got one more slide here. These are all kind of Medicare related, or I've got some additional things. So these Advantage plans above and beyond what Medicare offers, and these complement Medicare. There's some other stuff here. So there. Oh, I'm sorry. There's another. I'm not going to go through this whole section of the presentation, but this shows tier 1 through 5. If you'll notice here, this is the example I use on tier 1. There's a $2 copay on the 30-day supply for plan 1. It's a $0 copay where you're paying the monthly premium, and a $0 copay for for the Advantage plan, the new one. There's a $3 copay for the PPO. So the same kind of thing, reflective. And then down here on the deductible, it's a $0 deductible for all 3 of these plans. For that PPO, it's a $0 deductible for tier 1 and 2 only. For tiers 3, 4, and 5, there is a $345 drug plan deductible. Okay, here's the extra benefits. Dental coverage. 2 of these plans have $500 of dental coverage. 2 of them have $1,000. That's one of the advantages of the Advantage plan. And then for plan 2 where you're paying, you get the additional. You get a $500. So both of these have $500 more dental. If you'll recall, I remarked the differences between these 2 plans. They're quite similar. What happens is this one costs less to go to the hospital, but this one has more dental. So it's kind of just a trade-off there. Routine vision, and they're all $0 copay for a 1-year annual exam. But for the one where you're paying the premium, actually there's an extra $100 more. These 3 have a $100 allowance towards frames. This one has a $200 allowance. For hearing coverage, actually the older plans have some $0 copay for an exam, and there's some price breaks on equipment, hearing devices. There's no hearing coverage on these 2 newer plans. Insulin savings, all of these have insulin savings program where you can get a month's supply of insulin for $35 or less. 3 of these have an over-the-counter benefit. Perhaps counterintuitively, the one where you're paying monthly premium doesn't have this benefit, but the other 3 do. And it says $160 per year. It's actually $40 a quarter is what it is, but you can use it for over the counter. You could order these from a catalog over phone or online, and you can get aspirin, allergy medicine, digestive, even Band-Aids. So personal care that's not prescription, you can order those. So what you might get from a pharmacy, $40 a quarter. So that's a nice benefit these provide. And then gym membership. Not kind of like the pharmacies, not every single gym in the world is a member, but many gyms close to you will take this membership. It's called Renew Active through United Healthcare, but it typically results in a free gym membership. Having said that, these are very specific information. These are the plan numbers and what counties in the northern Texas area these are available. What I would offer to you is this information is available in this presentation. Wherever you live, there's one or more of these plans, there's a similar plan there. So I hope that this has helped you kind of discern some different features between 4 Advantage plans and recognize that something like this is likely available near you. United Healthcare, more than 40 years serving the Medicare community. There are other carriers out there, but few have 40 years or more taking care of Medicare beneficiaries in particular. More people in the U.S. use United Healthcare for their Medicare plans than any other. So they're number one as far as market share. They have a high retention rate. Typically, people enroll in United Healthcare plans and they are quite satisfied and they tend to keep them. They have high retention. People do typically not roll off. And that's because they really are committed to helping you, Medicare beneficiaries, live a healthier and happier life. The plan themselves demonstrates that, but actually, United Healthcare offers services. They're in contact with you via phone and via email, checking on you, making sure if there's any way they can help. Some additional resources I kind of remarked about this. Medicare Made Clear is a hard copy. I think we can make an electronic copy. It's not unlike this presentation. It's a nice overview of how Medicare works. You can go to medicare.gov or you can dial Medicare and get information and resources and get questions answered and assistance there. Medicare and You is a document, a booklet typically mailed to you once you turn 65 by the Medicare, the government organization itself. There are online plan finders at Medicare.gov and at the carrier sites. State resources, you can Google and find, for example, help on Medicaid, which is the state financial assistance program. Health and Human Resources, those are available online. Social Security Administration, you can call them or you can go to ssa.gov and there's plenty of resources and help there. I kind of remarked you can pay for a Medicare Part B from a Social Security benefits if you're getting Social Security benefits. And then you can also find elder care locators. That's available online as well. So these are just some of the resources that are available to you. For me personally, I'd like to help you on this. Send me a list of your doctors and I can check them and make sure that they take plans that are in your area. Send me your list of medications and I can show you the estimate on what the pricing will be, because it'll do the analysis and put your drugs in the tiers based on the formulary of the plan and show you the pricing at different retailers, actually different pharmacies in your area. I can help you find gym membership, for example, fully utilize the benefits, maybe the over-counter. I can help you there. If you're a veteran, I can help you as well. Let's talk about that. For example, we don't want to mess up your VA coverage if you've got TRICARE, that kind of thing. But if you like some of the bells and whistles that are shown here, we can give you an advantage plan, for example, that doesn't have a drug plan included. You can continue to use the drug plan coverage from the VA, but you can still get the bells and whistles, these additional benefits from the advantage plan. So to reiterate, my name is Tom. There's my phone number. I'm best accessed via email. Drop me a line, tom.basie@gmail.com. Send me some questions or send me your list of doctors and pharmacies in your zip code and tell me, hey, Tom, do this analysis for me. I want to help. So I'm here. I hope this has been beneficial to you. Please feel free to reach out to me. Thanks for stopping by, and you have a good rest of your day.